Hi, my name is Natalie Musi, and on behalf of all of us at Los Robles Health System, I want to thank you for standing by us through the COVID-19 pandemic. These past few months have been difficult for all of us, and as your healthcare team, we want to encourage you to continue to prioritize your health. One of our long-standing traditions at Los Robles is to host our annual Power of Pink Symposium. It's a time where we're able to educate our fellow community members on the importance of screening and early detection, as well as the latest breakthroughs in research, diagnosis, and treatment. The Power of Pink Symposium is an event that we look forward to each and every year. And although we can't meet in person this year, we're excited to empower our community virtually throughout Breast Cancer Awareness Month. In order to view our segments, make sure to tune in to our weekly series every Tuesday in October at 6 p.m. Our breast cancer seminar videos will be available across all Los Robles Health System social media platforms, as well as on our website, www.losrobleshospital.com. Although we won't be able to personally see you this year, we're committed to connecting with you and would love to hear your feedback. Please feel free to reach out to us and share your comments and suggestions for future presentation topics by visiting our website and clicking on our Power of Pink banner. Thank you for choosing Los Robles as your healthcare partner, and we hope you enjoy our virtual seminars. From our family to yours, we wish you well.
Hello and welcome to today's discussion on treating the breast cancer patient during the COVID-19 pandemic era. I'm Dr. Gabriella Sherman, Chief Medical Officer at Los Robles Health System, and I'm joined here today by a group of 3 panelists, and let's go ahead and meet them. We'll start with Dr. Sujay Dutta.
I'm Dr. Sujay Dutta. I'm an infectious disease specialist here in Thousand Oaks.
I'm Dr. Mark Suski. I'm a plastic and reconstructive surgeon here in Thousand Oaks. I'm also the current Chief of Staff here at Los Robles Hospital.
My name is Catherine Moses. I'm a physician here at Los Robles, and I practice diagnostic and interventional radiology.
Okay, let's start with Dr. Dutta to kick us off with our first question. What have we learned about COVID since the pandemic started, and can you tell us more about treatment options that exist today?
Sure. We've had a greater appreciation for both the aggressiveness of the virus, its pathogenesis, and the way it spreads. And we've had some recent treatment interventions which we can introduce to the hospitalized patients to improve their survival and have them discharged from the hospital at an earlier date with better function once they get home.
Wonderful, thank you. Dr. Suski, I know we've been very busy at Los Robles treating COVID patients. Tell us a little bit more about our COVID response team.
So I think the best way to answer that question is going back to mid-March when COVID kind of struck the country and the world. At that point, the medical staff leadership as well as the administrative leadership at the hospital worked together. We developed a COVID response meeting, which occurred every single day for about 4 months. Now we're meeting on about twice a week to discuss aspects of COVID that are unique to Ventura County and specifically to the hospital.
Great. A lot of good work by a lot of our physicians here. So thank you for that. Dr. Moses, today's topic is about treating our breast cancer patient during COVID-19. Tell us a little bit more about what you've seen, how COVID-19 has impacted breast cancer screening in the earlier days of the pandemic as well as now.
So when the pandemic struck, or when we really realized that it was serious in March, everyone was kind of in panic mode, including healthcare providers. We look to our societies to guide us. So in my case, it's the American College of Radiology, and soon after, maybe a week or two, they made a decision to stop elective procedures and only do emergency procedures and operations. And we do our breast work at an outpatient office at Thousand Oaks Radiology, and at that point, we decreased our time to half days, but mostly that was a response to the patients. At no point did we turn down any screening patients or diagnostic patients. It was all patient-driven. But starting in March and April, we saw our screening numbers decline 75%, which is pretty astounding. And early studies indicate in this country that most places experience 25 to 30% reduction. And then as we became more knowledgeable at the virus and what it was doing, that really helped a lot. And I think what it did is allayed the fears of a lot of patients, and they trickled back. They slowly started coming back, and luckily in our community we never had large numbers, and I think people realized that, and we started safety measures, and about May we opened up to full days, and our schedule is almost back to normal for screening and diagnostic exams.
That's great, thank you. Dr. Dutta, now that COVID has been here for more than 6 months, we keep hearing about vaccines in the news. What should we be aware of? When do you think a vaccine will realistically be available to the public?
I think we've seen an unprecedented research effort by the whole world, by both pharmaceutical companies and research universities. Currently, there are 36 vaccine candidates registered at the World Health Organization. And out of those, 9 are in phase 3 clinical studies, which has never been seen before. I anticipate at least 2 or 3 vaccines should be available, FDA approved and ready for the public by early spring of 2021.
Okay. And Dr. Suski, what have you seen in terms of patients accessing care for procedures at the hospital? Is it safe for them to come for non-COVID reasons?
It's absolutely safe to come for non-COVID reasons. You know, as a surgeon in my practice, as the summer evolved and we started to reopen up for non-urgent or non-emergent, essentially elective surgical procedures, we had a number of patients who initially were feeling a little bit uneasy about coming to the hospital. But I think we were able to reassure them very nicely. When patients come to the hospital, if they're going to be admitted, there are wards that are specific to COVID patients, and so there's never going to be a mixture of a COVID patient and a non-COVID patient. That even extends into the operating room, where we have defined operating rooms that are specifically to be used only for a COVID patient. So it's really almost impossible for any non-COVID patient to come in contact with a COVID patient here in the hospital. And I think that's been very reassuring for them. I've certainly seen my surgical volume increase over the last couple of months.
Now I'd like to introduce you to some of our team members that are here keeping you safe at Los Robles Health System.
Well, any patient that is coming here to have an elective surgery or a procedure done must be tested prior to coming into the facility for that procedure. Now, we have an absolutely fantastic process for our COVID screening, whereby the patient can drive up in their car, they don't have to get outside, they can stay in their vehicle, they can be with their family member, and we test them directly in the car and they move forward. It's very, very good for the patients because they don't have to go somewhere into an office or a clinic and risk being exposed to somebody else that might be sick with COVID. Any person that is in an immune compromised state, which clearly someone who is battling cancer is in that state, whether it's just from the illness itself, treatments that they've received, they are in a position where they're at more risk for things to be able to affect them. Not just COVID, but many, many things can affect them in that state. So by being able to come here and just present yourself in your clean environment, we're clean coming up to your car. Our staff takes all of the precautions that are required so that when they approach you, they're not risking your exposure to anything and you're not risking them being exposed to anything. So it's really very, very satisfying. Patients that come through are happy and just really thankful that they didn't have to go somewhere in a big room and wait with a bunch of people to get this testing done.
So infection prevention is something that's on everybody's mind these days. We take precautions for every patient. As we know, there are a lot of different things that any patient can contract, and we want to make sure that we avoid any of those things. So the first thing is making sure everybody wears a mask at all times. We have a strict enforcement policy around patients, visitors, physicians, nursing teams, anybody who is going to come in contact with any person in our environment must wear a mask at all times. In addition, we also take extra COVID precautions to make sure that we're temp checking folks. We limit visitors and other persons in the hospital, really only those people who need to be here, because minimizing the amount of exposure anybody can have to persons that aren't under our care where we know what's happening with them is really important in preventing any type of communication of any kind of disease. So in addition, we also use spacing and markers to make sure that patients and persons are keeping a social distance to ensure that nobody is too close. We try to ensure that everybody's in a private space as much as possible for each and every level of treatment or care. And in addition, the biggest thing is really washing your hands. So that's a big thing for everybody. We make sure we have enough stations everywhere, not just for the caregivers, but for anybody else who might come in contact with the surface. And then of course, we're frequently frequently cleaning any high-touch surfaces, and of course cleaning and turning over every room.
Hello, my name is Sue Sanseri. I'm a registered nurse here at Los Robles Hospital. I want you all to know that this is an extremely safe place to come at this, especially at this unusual time in our world. And I just want you all to feel and know how safe it is in the operating room. We've taken extreme precautions to make sure everybody is safe, and we have the right instrumentation, we have the top cleanliness, sterility that you could imagine, and I've been to many places, and I would be happy to have my own family member here. I mean, this would be very, very warming to me, knowing that we have such great people, kind, caring nurses in our operating room, all the way down into PACU. We're there for you, we'll listen to you, we'll hold your hand, we'll even cry with you if you want us to.
So we keep hearing a lot from our community. We understand your concerns. We know that it's a scary time right now. It's definitely not a normal state with the COVID-19 pandemic, and we want you to rest assured that it is safe to get your care here at Los Robles Health System. So I thought maybe we could spend a little bit of time with our panelists talking about the different safety measures we put in place and maybe what they're hearing from some of the patients in our community as well. So Dr. Suski, I'm sure you hear about it from your patients who maybe aren't sure if they should have their surgery done. Should they wait? Is it really safe for them to do that now?
Right, so we hear that a lot from the patients when they come for consultations in the office. Many of them are even scared, even just coming to the office. They'll sometimes call up, they'll want to wait in their car until they know that the waiting room is completely empty or that they can be immediately placed into the exam room. One of the first things that I really encourage them to understand is that they do not want to delay their treatment under the current COVID. For two reasons. One, the hospital is incredibly safe right now for some of the reasons that I had previously discussed. Many maneuvers have been made in the hospital to ensure that COVID patients and non-COVID patients are not going to be interacting on a regular basis. And I know for breast cancer patients, especially those who have either just previously undergone chemotherapy or currently or in the future going to undergo chemotherapy, that's a big concern for them. So I think it's very important that they do understand that, you know, they are going to be very safe here in the hospital. The visiting hours have been restricted in some measure, and that also reduces the amount of lay people that are in the hospital as well. All of the physicians, all of the nurses, all of the support staff wear masks, appropriate PPE when they're treating patients. So there really isn't anything that they need to be worried about in terms of undergoing surgery. And we certainly don't want them to delay any surgery that could have a negative impact on their ultimate diagnosis.
Well, you know, there are obviously people are concerned in the community about catching COVID from healthcare facilities, and they should realize in general the healthcare facilities are safer than the general community at large, mainly because of the mask mandate. We are required as visitors and employees and healthcare providers to be wearing masks in the hospital, and all the patients who are COVID infected or have COVID-19 or are suspected to have it are segregated in a safe place away from the general patient population. So the hospital is a very safe place to come, and patients should not feel scared that, and certainly not delay their care being concerned about contracting COVID-19. It's a safe place to be.
And Dr. Moses, what about with all of the preventive studies like mammography with patients that are standard risk in our society? A lot of them may think that it's okay to delay that, wait another 6 months, you know, nothing has happened thus far. Why should we go get screened now and potentially expose ourselves to COVID? What advice would you have for them?
Well, I think that there's just mountains of data that support the fact that screening mammography saves lives through early detection and early treatment. And these gentlemen told you why it's safe, so I don't really need to speak to that anymore. But for me, the way I look at it is, in the beginning, we were all stunned. We didn't really know what was happening and were we going to go to the grocery store and get this disease and die from it. But I think 6 months later, we know a lot more. The whole discussion reminds me of the difference between fear and courage. And I think a lot of what you're seeing is fear-based. And the other day I was talking to my husband about something unrelated to medicine, but I told him, I said, you know, I just don't feel like I have courage. And he's like, what do you mean? Because I'm afraid. And he said, you don't understand what courage is. He said, it's not the absence of fear. It's you have fear, but you act in face of the fear. That's what courage is. I think it's important to remember that, and especially we shouldn't act out of fear, and that we should look at our situation and measure our risks. And with everything we've talked about, we are putting best practices out there, and we are as safe as we possibly can be. And I think that in terms of screening and diagnostic mammography, I think it's essential. And maybe they call it elective, emergent, all this other thing, but I think all healthcare is essential, just like grocery stores and gas stations and drug stores. And what happened in the beginning is that people weren't getting the care that they needed. People with chest pain were not coming to the ER, and there's many anecdotes of, I know people that this happened to, and I'm sure you do too, because of fear, they didn't get the treatment, and they died. I mean, the worst possible outcome that you can think of through, ignorance, lack of knowledge, but basically fear. And I think that's my message to people, is that it's okay to be afraid. It's normal to be afraid, but to take a breath and look at the risks in your particular community, in this particular hospital or my office or your office, and think about that and take the necessary steps to take care of yourself.
Dr. Dutta, we've seen communities open and then quickly close. What advice do you have for our community as we continue in this new normal?
I think communities can open up towards a sense of normalcy following the three principles which we've been talking about for the last few months, which is wearing face coverings and masks, social distancing, physically distancing 6 feet more, and washing hands. And if we simply follow those three practices, we will be able to open our communities closer to what we view would be normal.
Okay. Dr. Moses, do you think there will be any deleterious effects in the clinical outcomes of breast cancer patients due to delayed screening and diagnosis? And if so, what effects do you anticipate?
Well, I don't really know, and I don't think any of us really know, but a lot of people have projected based on really mathematical models. But the thinking is, if you delay screening, you delay diagnosis, which delays treatment, which could have worse clinical outcomes. So the fortunate thing about breast cancer is that it's usually slow growing and non-aggressive, and they predict that most women have had it in their breasts for a few years before it comes to attention, either on an imaging study or clinically. So I had a patient this week, in fact, who was being seen more frequently, short interval surveillance for calcifications, because we were concerned about them a little. They were growing. So she was scheduled to come back in March. I looked back at her history, and of course it's 6 months later, and like I said in the beginning, we didn't decline any patients at any time. But she came back 6 months later, and I inspected them, and I did think that they had some changes that were concerning. So I scheduled her for an image-guided biopsy, and in my head I was thinking, in this particular case, do you think it's going to adversely affect her? And probably not, because they were so small, and if it is cancer, it's probably the very early stages. But I think what people need to realize, and the physicians that are taking care of the patients, is that they need to really stratify their patients in terms of age groups, genetics, prior history, family history, and I think that's probably going to do a lot to stop the deleterious effects. But we're learning that as we go along. And I heard one thing that I read, that they predict 10,000 more deaths from breast cancer over 10 years based on this, which, it's hard to put a number on it, and I think these are probably mathematicians doing it. So I don't really know, but I think probably yes, depending on the risk status of the patient.
So is there anything else that can be done now to mitigate some of these deleterious effects?
Well, in my opinion, education, awareness, and community outreach are probably the most powerful tools. These are the cornerstones, and this is what we're doing right now. And just going back to what I said a few minutes ago, is that the healthcare providers, and particularly the primary care physicians, are really important right now, because they need to assess the patients in their practice and really look at, stratify the risk, and personally look at a personal care plan for these women and men. And we have a lot of good risk model predictors for breast cancer, and I think that's something that each woman should know, their lifetime risk of breast cancer, because that will guide what screening diagnostic tools to use. So I think what we're doing now, and also the physicians really giving personalized care to the patients as much as they can.
And now I'd like to introduce you to some team members at the Los Robles Imaging Center to talk about the importance of screening mammography.
I'm Michelle Barrett, and we are at Los Robles Imaging Center, and we're a department of Los Robles Hospital. And right now we're in the mammography room. And as you know, October is Breast Cancer Awareness Month, and we are running a $99 special as we do every year. And October, we're very busy. We have a lot of patients who are return patients who are used to coming here for their mammograms, and we try to make it a fun month, usually under normal circumstances. But we do 3D mammography. We also do soft touch mammography. Not a lot of places do that, but this pink pad that you see right here is a cushion, and it makes it a lot more comfortable for the patients than just having them put their breast on this hard board. So that's something that I'm really happy that we offer, and our patients love it. With COVID, of course, patients have been afraid to come to the doctor. They don't want to get exposed. They don't want to sit in a waiting room with other patients. And so a lot of people, well, they were staying home. We had to stay home. So women now are just starting to come back, and we are pretty busy with mammography. We make it safe for the patients. We're constantly sanitizing behind. We social distance in our waiting room. And we encourage patients to come on in. Just because we're in a pandemic and things are really different for us right now, we are still able to accommodate them. And early detection is the best protection against breast cancer.
And I thought we can close with you, Dr. Suski. You've been heavily involved in the COVID response here at Los Robles Health System. What are you most proud of as the Chief of Staff?
So as Chief of Staff, I really have the honor to represent and to lead the medical staff. And although this has been a very challenging time, what I would say is the medical staff has really risen to really incredible standards during this crisis. So has the nursing staff and pretty much everybody who works here in the hospital. And that's been an incredibly satisfying situation to behold. The other thing I would really like to comment on is the tremendous support generated to the hospital and all of the employees by the community at large. During the early days of the crisis, I mean, we had local caterers, restaurants dropping food off on a regular basis. We had school children writing very inspirational comments on cards. I've kept a few on my desk. We've had artisans who have dropped off things, as in gratitude. And so I think really, although this is a horrific pandemic, it again shows the endurance of the human spirit and the great community that we have a privilege to both live and practice in.
I had one volunteer that has made over 7,000 masks for this facility that have been distributed to patients, visitors, employees, as well as their family members. So I think it's really nice to see the community come together, as you've alluded to. So thank you for joining us today. I know I learned a lot about how we can better treat the breast cancer patient during this time of COVID. It's definitely not a normal state for us to be in, and we are constantly learning more. I'm encouraged to hear that vaccines are on the horizon and that hopefully we'll be able to reopen our communities safely very soon. Again, thank you for joining us. Thank you to our panelists, Dr. Dutta, Dr. Suski, Dr. Moses. Thank you for your time and expertise.
My name is Joanna Ortiz. I'm a respiratory therapist at Los Robles Hospital, and I'm a breast cancer survivor. I scheduled my annual appointments, and so it was about 2 weeks out, I think 2-3 weeks out before I was actually seen. But I noticed, like, I was in the shower, washing my armpit. I felt something, went back, couldn't find it. I thought, okay, mental note, I'll make sure to let him know when I go see him. I also had some discoloration on my breast, which was very smooth. It didn't really appear as breast cancer appears. I guess breast cancer can change the texture of your skin. Mine was very smooth. I'm prone to rashes and stretch marks, so I didn't think anything of it, but I was like, this is weird, why isn't it going away? Another mental note, let me let him know when I see him. One other sign I had was it was, chilly, and so I had kind of put my hands in my armpits, and I noticed that my breast was warm. So that was the third sign. And I Googled that, which really you shouldn't be doing because you will go nuts. And it basically was like, this could be breast cancer.
And then next thing you know, I get a phone call. I'm at home, and she tells me that I have been diagnosed with breast cancer. I was by myself, so it was obviously like a long night for myself. I wasn't able to sleep. It obviously affected me a lot. Being that my best friend, his mom had passed away from breast cancer, so it's always been around me. And obviously, with that being said, I had the worst possible thoughts.
I was diagnosed the first week in January, basically, of 2015. I had all my treatment at Los Robles Hospital, all my workup at Los Robles Hospital. I had great care. HER2 positive breast cancer, stage 3. So it consisted of the chemotherapy for 6 treatments every 3 weeks, 6 cycles, followed by surgery and then radiation, which was, I think, 35 treatments. So it was pretty tough. It was very tough. I kind of gauge my life on experiences, and that was one of the hardest things I've ever done.
I already knew she was the strongest person I know, but after everything that was going through, for sure put like a title on, or a cap on it, for sure, being the strongest person that I know. Because it's not easy. I mean, I know how frequent it is that, you know, male and female are diagnosed with breast cancer every day, each week, yearly. It's not anything anyone wants to deal with at all.
I always say it starts with 2 things. Yourself. It might sound cliche about being like positive, but it really, you should allow yourself to go down the dark road and deal with it, have your moments of crying, but really to get through, it's a positive mindset and have a good support system. I'm pretty independent, and it's difficult to say, yes, can you bring me food? Can you take me? Can you pick up my meds? You know, that's a little difficult. Yes, you can bring me food, you know. It's hard. That's the hard part. That's what I actually tell people. You know, I've kind of helped people along the way because I learned a ton of stuff, and I've kind of said, you just have to say yes. If somebody wants to, you have to.